Hi, Dr. Choucair. I'm a board-certified plastic surgeon in Dallas, Texas, focusing on facelifts in a large majority of my practice. And continuing on our series on facelifts, the question that we're going to answer next is, well, what's my recovery from a facelift? And so again, like many of these things, you have to break down the details. You know, you can't just make a blanket statement in general and say the recovery is X or Y. So again, focusing on the typical facelift that we most commonly do, which is a comprehensive lower face and neck lift that improves the face from here to here, doing the deep muscle repair here and then gently redraping the skin, typically with incisions along the sideburn so we don't move it, inside the edge of the ear, in the crease, and usually down the edge of the hairline with a small incision here. Well, how long is the recovery? Well, most patients will either go home the night of surgery or stay in an overnight facility just to be monitored instead of having to bother their family. And the next day, the two little drain tubes about the diameter of a pencil, soft rubber tube that comes out behind their ears that makes sure they don't collect any fluid in the neck, is removed the day after surgery. They can then shampoo and shower, and typically with just a lower face and neck lift without injections of fat or other things, there's very little bruising. In fact, patients can theoretically put makeup on their entire face the day after surgery. Now, of course, they have sutures or stitches along the incision that come out 4 to 5 days after surgery. And then they can technically, the day after the stitches come out, put a little makeup on those incisions. But most patients who have hair that covers it are never concerned about that. So can patients go to the grocery store or the drugstore a day or two after the surgery? Theoretically, they can, especially if their hair is covering the incision. And the little incision here is covered with tape, so it's usually very unlikely someone would see it unless they're, you know, an 8 or a 9-year-old looking up at someone. So this is typically not something that's visible by other adults because you're looking straight at them. We've had patients, you know, go out to social events within a few days. Yes, that's not as typical, but it happens. Now, if you start injecting filler or fat along the face, or doing eyelid surgery at the same time, everything changes. Then the recovery can be at least 7 to 10 days before they're either in cover-up makeup or out and about, because the bruising when you do anything around the eyes or you start putting filler in the face, which is part of many facelifts these days, is of course different. So I'm talking about just the facelift. But what about after that? Well, exercise where you're raising your heart rate and your blood pressure significantly is usually at least 2 weeks. Yoga or anything with have maneuvers where your head is down consistently is 4 to 5 weeks because it's too much pressure on your head. Running, anything with a lot of bouncing or movement like that, is usually 3 to 4 weeks. We vary it based on each individual, but in general, those are the criteria. When can most patients, you know, go to dinner with friends and not have to look across a well-lit table and answer questions about their facelift? Well, again, if it's just their face and there's no injections that cause bruising, then usually a week later, it's very difficult for most friends and people who even know you to know you had the facelift if it's executed properly, because there's no abnormal pull. Typically the swelling is not noticeable because it actually makes you look better when your skin's a little puffy. And most patients have a little makeup on. The incisions, even in men sometimes at a week, are hard to see because the incisions are well sutured and they're very thin lines if the facelift is done properly. So socially we say about a week. Again, all this changes if you're doing anything to your eyes or if you're having fillers. Then you may have to hide a little bit more, and we'll say maybe 2 weeks. Depending on what's done. Again, the devil's in the details, so you really have to check with your surgeon about what in particular you're doing. But most facelifts are back to having facials, laying on a massage facelift face cradle at 6 weeks. 6 weeks is the outside number because that's when wound healing is basically 95% strong. At 6 weeks, patients can do pretty much whatever they want without fear that they're going to cause any problems. Could they have a little swelling after a heavy workout even 6 weeks later, or a yoga move? They could, but that's not of any great concern. Patients can color their hair usually after 3 to 4 weeks as long as there's no heat, because after most well-done facelifts, if the incision comes down the edge of the hair, this hair back here, you could get a little bit numb and you could burn this skin could be a little numb, and you could burn the skin if you're blow drying if you don't feel it. So we have patients put their fingers there and blow dry through their fingers for the first 6 to 8 weeks. Little things like that. But in general, a facelift recovery is not as drastic as many patients think. Again, the details are where it really matters, and whether you're doing fillers or eyelid surgery changes everything. So anyway, I hope those details help you kind of get an idea about a facelift.